So in this segment, we will be focusing on our last cranial nerves 10, 11, and 12, our favorites. Cranial nerve 10 is the vagus nerve. As you remember, it is one of our autonomic nerves. 3, 7, 9, and 10 are autonomics, and the vagus is going to be sensory, motor, and autonomic. So sensory to taste, etc., motor to pharynx, larynx, and autonomic to the heart, lungs, and guts, and the abdomen and thorax. So, what parts of vagus can we see? Most of the parts of the vagus that we've already seen in the semester have been down in thoracic cavity. Remember that as the vagosympathetic trunk coursed all the way down to our middle cervical ganglion, passed through that because it wasn't sympathetic or parasympathetic, and then split into dorsal and ventral branches, and then they turned into dorsal and ventral trunks and went into the abdomen. What we can see, however, now in our head dissection is we can follow that vagosympathetic trunk up to where that distal ganglion of the vagus is going to be located here, okay? So vagosympathetic, remember sympathetic and parasympathetic. The sympathetic part will be the cranial cervical ganglion, that is the most rostral portion. Caudal to that will be the distal ganglion of the vagus. Vagus is going to be starting its nerve cell bodies up here in the brain. So remember, things are starting in the brain and coming down the vagosympathetic trunk. Things from the sympathetic nervous system, the nerve cell bodies, started in the thoracic and lumbar parts of the spinal cord. And this is our last chance, or our last ganglion to synapse at if we want to distribute sympathetic innervation to the head. Right? But all of this is located right around the same area, so when we talk about it together. All right, so that would take care of our vagus. In terms of where the vagus comes out, just like the other nerves we talked about, the jugular foramen and that tympano-occipital fissure are going to be important for the vagus nerve. Cranial nerve 11 is accessory. Once again, that one is going to be leaving that jugular foramen and the tympano-occipital fissure and being motor to the some of the muscles, the sternocephalicus trapezius. So again, if we look right around this area of that the tympano-occipital fissure, where all of these things are coming out, we see this beautiful nerve heading south, and that's going to be the accessory nerve. The next nerve then would be cranial nerve 12, the hypoglossal nerve. Hypoglossal, as its name implies, is going to be motor to the tongue. It actually has its own little canal that it comes out of. Oops, I'm not sure if we're going to have a little, we might not have that one on the inside. But the hypoglossal canal is going to be right here. So here was our tympano-occipital fissure, there and there, and that would be the hypoglossal canal. Hypoglossal nerve is, if you don't get this one, I will kick you in the knee. The hypoglossal nerve is this big, huge nerve, has a friend that it travels with, the lingual artery. Okay, so a hypoglossal nerve and lingual artery will always go together. The glossopharyngeal is another cranial nerve you could get it confused with, but hypoglossal is going to be lateral to the external carotid artery. Remember, glossopharyngeal is going to be over here and be medial to the external carotid artery. I can just very quickly show you another example of that. Here we can see this big tympano-occipital fissure with some of the nerves that we've already discussed. So So here would be your accessory nerve coming south, our vagosympathetic trunk with our distal ganglion and our cranial cervical ganglion, and then our hypoglossal nerve here. So that concludes the cranial nerves.
Yay.